To solve the biggest problems in healthcare, we're going to need all the stakeholders to come together.
This is a team sport. There isn't one person, system, or company that's going to fix it all.
We know that in order to make things happen in health tech, we need the ecosystem to come together to collaborate. What better place to do that than right here at the Digital Health Festival in Melbourne, Australia?
In this special feature episode recorded here at the Digital Health Festival, we interview speakers from the festival at the Talking HealthTech pop-up studio, right here on the festival floor.
Here at DHF, you'll find all of Australia's leading healthcare innovators, decision makers, investors and advocates, with over 6,000 visitors from here in Australia and all over the world.
We recorded so many conversations here at DHF that we can't show them all in this episode. So once you finish with this one, jump over to our YouTube channel to catch the rest.
Collaboration starts with a conversation, Team HealthTech.
Let's make it happen.
That's pretty good.
Welcome to Talking HealthTech, featuring content and community about technology and healthcare. We acknowledge the traditional owners of lands these conversations were recorded and pay respect to elders past and present.
I'm Amanda Burry. I'm the Chief Commercial Officer at Infermedica. Infermedica is the market-leading AI symptom assessment for patients, members, health plans, to help really direct and guide their patients and members to the right level of care. We really focus on providing convenience, cost, and accessibility, and we do that through an AI approach. So imagine it's 10 o'clock at night, your ear's hurting you, and you don't know what to do. We help provide an assessment that you can take that is then redirected back to your provider or to your plan, and they're going to kind of configure what you should do. Should you go see a telemedicine provider? Do you need to do nothing and just self-care at home, or do you need to call 911? It's all about providing those patients the best level of care and the best direction of care possible.
It's amazing. So I guess, how have you seen that kind of tool taken up in the Australian space? It must be quite different to working in the US, where you guys are from. How have you seen the differences in the two markets?
Yeah, so I always say we have the luxury of working with over 100 customers in 35 countries. Yeah. So we're a European, Polish-based company.
Oh, cool.
We also have a US entity as well. And so among our customers, we see multiple different implementations of our technology. We provide a flexible API that allows people to manage and control workflows that they're looking to achieve for their patients. Yeah. One of the areas that we are focusing on here in Australia is with a customer, NIB, where they have actually installed our symptom checker inside their mobile app. And so they are providing an engagement and education tool for their members to be able to triage to the proper levels of care, giving them that experience, giving them that accessibility in the palm of their hand to be able to become knowledgeable about what's happening with them based on how they're feeling.
Yeah, well, I guess we hear our healthcare system is so pressured. Not everyone can get to the GP quick enough, and we don't want to be funneling our people into the ED unnecessarily. Have you seen that as a sort of a solution provider that you guys are providing?
Yeah, it's one of the areas where we're providing the most value. Is we know that there is a lack of providers. In the States, for instance, in 10 years, we're going to have a lack of physicians by about 50,000. We can't even really educate or train people in that period of time to catch up. So we have to leverage AI tools and technologies to be able to help bridge that gap.
Yeah.
And so one of the ways that we're doing that is, how do we provide that, those low acuity primary care cases where going to the GP might take 26 days to get an appointment, or 10 days, which is even still too much. How can we help provide you a quicker teleconsultation or some self-care at home? And in addition, we really want to keep people out of the ED and keep that open for people that truly need it. So we're really helping to navigate or direct those patients to those right care endpoints.
Yeah. And I guess AI has obviously been a huge theme for this conference, and it was a little bit there last year. Mm-hmm. Is AI new for Infermedica? What's it been like transitioning into the AI space?
Yeah, so we've been in business for over 10 years, so AI is not new to us, but we really look at AI as we want to be responsible and we want to come across as trusted, which I think are the two most important factors to anybody getting into AI right now. We've gone through years of testing our technologies, getting third-party clinical validation, which I think is really critical. And we also provide environments where people can test and sandbox the different workflows that we have. And so AI in healthcare has also not been new. So it's been around for about 30 years, whether it be radiology or imaging, they've been using those AI workflows for stroke detection. I just think now it's become more consumer facing. And so it's getting that recognition of, is my doctor using AI? Does this mean I'm going to get less time? And instead of turning it scary for the patient, I think it's an opportunity for us to educate and engage them and let them know when AI is being used and how it's going to help give them a better level of care.
I love that. You see it as a real opportunity. I think that's one of the things I've been hearing as well. I think we're excited to use AI, but responsibly, as you've said. So I guess working in your space, what do you see as the challenges to kind of healthcare at the moment, digital health?
So I think some of the challenges, globally and also locally vary, but there are similar undertones. So although I'm US based and although our company is based in Europe and we have customers all over, we see a couple of similar challenges. Number one is the overcrowding of emergency departments. So this idea that people can't access the care they need, so they go to a place that they know is open for them, which would be an emergency department. I think the other part is, listen, there are so many channels and tools for patients to use, and we've really saturated them with a lot of different technologies, but we haven't educated them enough to know how to use them. So getting patients to the right place at the right time with the right level of care still holds true today across different global markets. So I think really providing that education pathway point to how do I achieve the care that I need to. And then in addition, just really looking at some of the challenges around telemedicine. In the U.S., we're starting to see it wane a little bit in terms of usage, whereas in other places like the U.K., there's overutilization. So I still think we need to look at telemedicine as not this whole separate delivery channel, but just another pathway that a consumer or a patient can choose as a care path. We need to look at an in-person visit and a telemedicine visit in the same light. We need to reimburse them at the same cost and treat them as an appointment equally. And I think until that's done, there's still going to be a lot of velocity in that telemedicine space.
Good points. I guess any key takeaways that you're going to take back with you to the US that you've taken from Digital Health Festival Melbourne?
Yeah, so it's been great being here. I think some of the takeaways are, there is a lot of opportunity in Australia, especially as it relates to the longitudinal record of the patient, right? Connecting the patient record across different care pathways, as well as a lot of digital front door activities. So I think digital front door is a big theme here. But until you can really kind of have that patient interoperable between different positions, it might be a little bit challenging, but also very exciting because it just means that there's a lot of growth and a lot of possibilities for patients to have a much better experience.
My name is Dr. Cara Burtz. I am a researcher and from the Centre for Digital Transformation of Health, which is here at the University of Melbourne. And one of the things that I'm focusing in my research at the moment is digital health equity.
So I guess what brings you to the Digital Health Festival?
The Digital Health Festival for me is like Christmas. It's where all of my family and friends in the digital health industry come together really to collaborate and think about what is the agenda over the next year for digital health, locally here in Victoria, but also nationally. And what do we want digital health to be in the future?
Yes, so important. So I understand you're presenting here. So can you give us a little bit of a sneak peek of what you'll be presenting on?
Yeah, so I'm running a panel on digital health equity, which is really thinking about what is the future roadmap for equitable digital health.
Right.
So we have 3 amazing speakers, and really what we're trying to do is give practical insights both at a local level for developers, but also thinking about what are the policy changes that we can make that will mean that digital health is, more accessible, more fair, and more inclusive across Australia.
Bound to be a great panel. I guess just by wrapping up, we're asking all the people who we talk to here, What, for the future, the takeaway that you would like those who are listening today to go away with?
Yeah, thank you for asking. I think the key thing about digital health equity is it's not just about access to technology. When we build digital health innovations, digital health solutions, we need to think about equity throughout the journey. It's from our early discussions and how we co-design with the communities who are going to end up using the solution, but also how we build and use data in the solutions. So it's very much in the development phase. Access is obviously important and we want inclusive access, but once the technology's out there, we need to be aware where it's inequitable and to sort of moderate that. So it's the whole life cycle, not just inclusion.
I'm Sean Stevens. I'm a GP, practitioner and chair of the Digital Health and Innovation at the RACGP.
Well, and also a host of The Good GP.
Oh, and that one too, working on Talking HealthTech and host of The Good GP with, my co-hosts.
Awesome. So this is your first time at the Digital Health Festival. What made you come this year?
Well, I got an invitation to speak, and I think there really needs to be a greater connection between clinicians and the tech community. And I think, the DHF is a perfect opportunity to get that, to sort of have that collaboration and cross-fertilisation. Just the ideas that you've picked up and speaking to people and the connections that you make at this festival has just been brilliant.
Yeah, awesome. And what were you speaking on?
So we were speaking on, I was hosting a panel that was looking at how technology can be better designed to engage with GPs. And I guess probably the key themes that came out of it were how busy GPs are, how you've got to actually appeal to what the GPs want, which is either saving time, improving patient care, or improving practice profitability. And also that, often the customer and the user for technology and general practice is very different. Usually it's paid for by the practice, the technology itself is paid for by the practice, but the GP, who's usually a contractor, is using the technology, and then, of course, the patient is using the other side of the technology.
And what were some of the key insights that the panellists brought to the discussion?
Yeah, it was a panel of 4 GPs, and it was mostly around that, the value proposition for having for introducing new technology and making sure that it was of value to the people who are using it. I've also reached out and met a lot of tech people who are very keen to learn about how they can connect with GPs. So if there's any listeners there who want to reach out and join with some clinicians, we have a group of 1,700 GPs within the specific interest group of the RACGP who are keen and have an interest in this area. So I'd really like to foster that collaboration.
Yeah, amazing. So from a high level, what are some of those takeaways for our listeners at what that contribution could look like when partnering?
I guess probably the key thing is if you've got a piece of technology that you really feel needs some clinician input, because I find a lot of the time people have a great idea, but it needs to be tailored in a way that's going to appeal to a clinician. And you need that clinical input at the sort of fairly early stage, probably even before beta testing.
Yep.
So if you can get that input, you can avoid wasting a whole heap of resources developing something that may not be at all what what the end user wants.
Amazing. So then the future of healthcare, that's what we're all here talking about and where we want to see it go. So you, RACGP, Western Australian Health, the GP and the tech collaboration, what's the future for you? What do you hope to see in the next year to 5 years?
I hope to see a flourishing ecosystem of clinicians with a bit of an interest and a bit of a knowledge of technology, working with people who are working in the nuts and bolts of technology, making solutions that really improve patient care, that can make the life of our patients and our clinicians better. There's so much burnout out there at the moment. Post-COVID, people are exhausted in the health sector, and so if you can make the quality of care better whilst reducing the sort of administrative burdens or the costs of doing business, then I think that would be really, really brilliant.
My name's Sahihi. I'm based in Brisbane, and I'm a co-founder and CEO of Foxo. And so Foxo is a real-time communication platform in healthcare. And I think, part of my story is that I really started in ad agencies outside of healthcare, and it's been this transition all the way through. So it's really exciting to be in HealthTech and trying to bring some of those digital pathways that have been enabled in other industries into HealthTech and healthcare to change outcomes.
Yeah, I loved hearing you. I listened to your panel yesterday, and I want to dive a little bit more into your journey from ads to healthcare to co-founder, because it wasn't the usual path that someone would take. Can you tell us a little bit more about that?
Yeah, I love that, because it's one of the things is when you're a co-founder, they say, what's your founder story? And so mine is a little bit different. So I did work in digital agencies. I did a lot of work in e-commerce, and that was about 15 years ago. And what I knew there was technology is one part of the innovation, but the other part is really the human element. How do we embrace it? How do you get adoption? And I was always fascinated with this. Then my journey progressed, and I ended up on the provider side in radiology communication. And essentially I could see all these digital pathways that had happened in other industries were hard to bring in. And then I talk about these two words, serendipity and chase. And so it was during COVID, and it was very serendipitous that essentially someone walked past, head of ops, said, oh, look, we've got this presentation on Foxo. And I was like, oh, what's Foxo? So essentially when I was there, I heard about this platform, but it was doing something very different. It was trying to connect not just physicians or administrators or within one org, different organizations within one network. And I'm like, that's the pathway to solving this challenge. And so I mulled on it, and over a number of months, I was like, how do you commercialize it? How do you adopt it? And so I reached out to them. I reached out to Luke, had conversations, entered the business, and then essentially became, in time, the fourth co-founder. And that was really my remit of what I brought to the table.
Yeah, I love that. It's such a great journey to get there, and you bring such a wealth of experience from these other industries to Foxo's very lucky to have you. So you sat on a panel yesterday. You were on a very robust panel. It was phenomenal women. You've all had such a diverse entry into the healthcare space and the leadership roles that you each hold. The feedback and the buzz about the panel since has been really positive. And I'd love to hear more from you about your experience of being on the panel and what were some of the discussion points.
Yeah, so it was I was so happy to be a part of it, because at the end of the day, I think the cohesive thought for all of us as women leaders, but I think all women in the audience who are leaders, because there's so much transferable skill, is that we are all trying to mentor each other and enable this leapfrog of change. There's all these system interventions, and it's taking us into this place that we're able to move forward collectively, and how can we enable each other? And I think sharing those personal stories that each one of the individuals on the panel was able to share helps everybody resonate, well, this is how we can move forward. And so I thought that was, really special. Just a side note, so I had invited her, my daughter was in the audience, and she actually came up afterwards. She says, I really learnt from everybody's story on that panel. So it's the collective that makes the impact. And so that was something that, really inspired her. So I was so thrilled.
Wonderful moment to have your daughter in the audience, and to then have that takeaway of looking at you up there doing that, and then as a role model. Wonderful. So I guess a bit of the panel is all very different journeys. You all have had the challenges in growing companies in so Kate Quirk for the last 20 years with Alcidion, you across the industries that you've been with, and Foxo is a younger company. What were some of the threads in the challenges, and I guess how they've been overcome across the panel?
So I love to draw on the other stories and how they resonated with me. That was very inspiring. So one of the quotes was, be your authentic self.
Yeah.
And I really like that. And so I'll share this as a story. So just the nuance on the difference in effectively business development in healthcare. When you're on a startup, you have hustle. You have to. And often, so I was working with someone in a collaboration, and they said, oh, well, you don't respond to emails for several days. You can't look like you're too eager because and I was like, that's not me. I'm hyper responsive and I'm super enthusiastic. And so I was like, no, I have to back myself. that's really going to be our point of difference. When you're a startup, you want to know that you'll help a company make this change with you. So I usually known for responding and, being, very interactive. And so I love that line about being your authentic self, which is what do you bring to the table, and to do things differently if it maybe doesn't fit the norm of what's expected in the industry. And so, yeah.
Yeah, no, I think that really resonated with the audience too. It was a little bit of like, be your authentic self, but if you feel like you don't fit somewhere, well, what's your little bit of weird or your quirk that's your value prop that you will fit somewhere and you will do great things. It's just finding that and being out, have the courage to lean into that a little bit.
And if I share it in terms of Foxo on that journey, being a co-founder, is the thing I love the most about Foxo, what the heart of it, the vision of it was, it's an agnostic platform. It partners with everybody. We're trying to create a layer of communication across the industry. And so that level of being authentic and being able to be open, be responsive, was this beautiful fit because we had to work with as many vendors, as many providers as possible. And so it's actually been, a win in that way. So, yeah, that was a nice comment.
Amazing. So then I want to dive into, there was a fact that I guess you shared, and it is how do we supercharge societies, environments, everything. And you had this wonderful example that I would love for you to share with our listeners.
Yeah. So in the midst of Startup Journey, I'm also doing an MBA through Melbourne Business School, and it's got 3 international modules. So last year had the opportunity with a cohort, we're a cohort of 30, went to the Indian Business School. And essentially we had some presentations from some Indian public policy professionals. And we didn't really know what to expect, but essentially they showed GDP trajectory post-World War II for certain countries. And so they showed Japan with this, huge uplift, followed by South Korea, and followed by China, and then followed by India. But they were actually commenting on that other countries had moved forward more aggressively in terms of growth than India themselves. And they said, what is the single thread running through this trajectory? And, there was kind of this pause, unsure, and then they said it was the universal education of girls in schools. When girls entered primary school and you opened up education, this changed the prosperity of nations. And so obviously India talks about the new India, and they're actually raising up capacity of girls, not just in primary school, but in STEM, and I know nations are. But it was just a wonderful revelation of, girls' education has the ability to transform society on so many fronts in terms, and, this flows back down the other way to agri-tech, health tech, how we interoperate, how we look at public health, how we're being vaccinated. It's wonderful that it flows back down. So, yeah.
So I'm Angela. I have been in the health system a very long time. I've had decades-long experience across the health system. Started out as a registered nurse in critical care, and then sort of switched into digital health about 2 decades ago. So I've been doing work, sort of local health district, then state, and then federal policy, large-scale digital health reform. And I'm currently now with Oracle Health for good. So my first time in the private sector, which has been a very big change.
Yeah, I can't imagine, but bringing lots of experience too, which is fantastic.
Yeah, and it's a clinical role, so it's, I think what I like about it is the fact that you get to sort of, I'm part of a broader clinical team, we get to work sort of right across, influencing kind of all of the different processes within Oracle Health. So not just sales, pre-sales, post-sales, working with clients, out in the health services, having a bit of an impact on sort of future thinking, and also on this, having a bit of an impact on sort of the product development, I guess. So it's a really interesting role, lots of scope, and I think it's been a good decision. Early days.
Yep.
So
fantastic. Yeah. That's great to hear. So what brings you to the Digital Health Festival?
Well, Nathan.
Yeah. Well, other than me.
5-year-old. I thought, yep, I'm there. Well, 2 things, I guess. One is that I'm here with Oracle Health.
Yep.
We have a booth, and so we're, I guess, using it as an opportunity to talk about all the great stuff Oracle Health is doing. And I'm also on a panel.
Okay.
So I'm on a panel speaking about all things clinical governance. I'm alongside 4 other amazing people, and we'll sort of bring sort of very different perspectives, I guess, and we're going to be talking a bit about, I don't know, the importance of clinical governance and what it isn't, I guess, and why it's so hard. So that's what we're doing this afternoon.
Yeah, I'm sure it'll be a great conversation. Yeah. I guess from that, for those who won't be able to be there, like if there's a couple of takeaway messages that you'd like them to have for our listeners at home, what would that be?
I guess my key message around clinical governance is that it's not as hard as people think it is, that it isn't a sort of it's not bureaucracy, it's not red tape. It does governance, I think, in general is a bit of a brand problem. And when people think about that, they think, that's going to be something that's sort of getting in our way.
Yeah.
It's a sort of something we don't really want to be thinking about. And that's not to say people don't want to think about it, but I think it needs to be embedded. So it needs to be sort of thought about as part of a kind of larger system, much like health. I mean, when we think about systems and we think about safety, we're thinking about sort of the kind of end-to-end, and clinical governance is really integral to that. And if it's sort of designed and built properly and embedded properly, then it should just be part of the sort of cycle of thinking, part of a culture, I don't know, part of a story. So
not just something bolted on later or
Yeah, totally. I think, my observation, having, been working in different environments, is that it doesn't always, if it hasn't been thought about properly at the front, the clinical governance people will come in toward the end and slow everything down. And that's really not the intention. I think, it depends on how much exposure people have. I don't know how mature the organisation is, how big, how small. But in the end, sort of, if we want to design, build and implement safe systems, if we want to make sure that the care that patients and consumers are receiving is safe and of a high quality, then it's part and parcel. So
have to be there.
But the only other thing I would say is that it actually doesn't have to be hard. There's lots of ways in which you can think about it, or lots of research out there to draw from, and don't overthink it.
Yeah.
Because there's a lot of people out there who can help.
And great. The one question we're asking all of the people who are here for the interview is, what's your big thinking idea? Something doesn't have to be to do with clinical governance, but a thought or an idea that sort of come to you as part of this festival that you'd like to give to our listeners?
I would say, for me, it's about, I don't know if it's a big thinking idea, but it's really about connection. So events like this are really about bringing everyone together. I mean, there's such a diversity of people here. There are thousands of people here, all different stripes, I think. And, it's a great opportunity to collaborate. So obviously you see old friends, you make new ones, but, as Pete likes to say, collaboration starts with a conversation.
Regina, I'm a gynecologist, and I have set up a multidisciplinary care model for women's health. And basically, I have an interest outside gynecology as well. So I love being a clinical educator, particularly looking at primary health and how we can support the care of women in primary care health. And also I have an interest in digital health, although if you ask my children, they were like, Mom doesn't even know how to turn a computer on or off. But I think that's the future in terms of being the platform on which we want to layer all the models of care that we can for the community.
Where did you get that taste for a passion for digital health as a clinician? Did it start somewhere? Has it always been there for you?
I think it actually, Regina, started from the clinical gap that I identified and the helplessness of how do we actually help women in the community. Mm-hmm. So I am very passionate about caring for women with heavy bleeding or heavy periods. And this started as a passion, and I think is bordering on an obsession now. But basically, because I was seeing woman after woman every week, and some of them quite depleted, because as you'll appreciate, it can cause iron deficiency, anemia. And then I would wonder, why has it taken 3 years? Why has it taken 7 years for this woman, otherwise very basically the women we care for are amazing. They are taking good care in other parts of their life. They're caring for so many people, doing so much other stuff. But menstrual literacy wise, sometimes can be quite basic. And so that was where I thought, maybe digital technology can help us bridge some of these gaps, help us raise awareness, not replace the clinician, but actually add to the consult and add to empowering women. Because the other interesting part, Regina, is that management of heavy bleeding has a number of options. So it's a place in medicine where we can say, actually, there's heaps of support. And work together to figure out what would be the best fit option. But it's about using that technology to make people aware that there is a lot of help.
And have there been particular tools that you've used in your practice to kind of help patients with heavy bleeding become more literate about it?
One thing we found helpful is cloud-based medical record system.
Yeah.
So that practice management system does enable the team, because the good part about multidisciplinary care is that you get the skill set, a varied skill set, and the value of, like, we have a GP in our practice. We see a lot of value from that, a lot of support from allied health. But the down part is that it does make the system a bit more complex to set up and maintain. And so that has been a true enabler, having electronic practice system that we can share the records. The other thing that I find is patient engagement tools. So for us to be able to tailor specific medical information for women. So for example, someone might say, look, I want to have more children. So 1, 2, 3 option may not be suitable for them. So we don't want to overwhelm women with things that may be less relevant. So it allows us to then weigh in on the options that may be more available for them if they choose. So it allows us to share information more seamlessly with patients, put patients in driving seats of their care. And the other tool that recently I found very helpful is an AI scribe. So I'm finding that it doesn't change, obviously, the time that we're spending with women, but it's allowing us to focus more on engaging with them as opposed to the part around documenting. So I feel that technology has so much to offer if we use it safely and we use it in a very in a way that we're respecting patients' privacy. But within those boundaries, there's lots of I'm finding, as a mere clinician, there's lots of advantages to different models.
You were here at Digital Health Festival last year to this year. Have you seen changes in the space in a year?
Yeah, look, I certainly think there's more flavor for innovation, and clinicians are getting more confident in saying, look, you know what, we actually want to do better, and we want to do a more varied role that includes technology. But in terms of my own personal journey, I haven't seen many gynecologists. I was even saying yesterday, in 6,000 participants, I might be wrong, but I haven't personally met or seen any gynecologist. I was reassured to see a number of femtech sessions, but I think there is still so much more to do.
So in the gynecological space, in the women's health space, and the multidisciplinary care space, what do you see as the biggest challenges over the next 5 years?
I think the biggest challenges are actually making the needs of the community accessible. So the first issue was around awareness, but once we nail that awareness battle and we say, hey, look, there is help, but how does the person at home actually seek that help? So then I think therein is technology is also an enabler of saying, look, you know what, in this community there, these 3 GPs have said they have a special interest in this, or there is an abnormal uterine bleeding hub. Like, for example, we've set up Australia's first abnormal bleeding hub. So we're saying, look, walk through our doors, we'll do your ultrasound, we'll do your biopsy if we need it, because obviously we want to make sure there's no underlying cancer or certain other causes. We will help you give your iron if your iron levels are low. We will organize surgical options for you if needed, particularly the day surgical options are a very good option for some women, like endometrial ablation, for example. So those awareness is one factor, but actual access. And then the other thing, Regina, that we know is cost of living is a very real situation for women. So there was a study that we did last year of 5,000 women, which is an online study, to ask them about heavy periods, and 25% of them said they do have it often or always. And when they were asked, half of them had not seen a GP. And when asked why, because they were deprioritizing. Women typically tend to care for other people before their own needs. But the second theme was cost. And so I think this is where we need to leverage the technology to empower the community.
Amazing. I feel like I could talk to you about heavy bleeding forever, but it's not a heavy bleeding conference.
I wish it was.
I feel like most of us did, actually. Dr. Talat, it's been a joy speaking with you. Any final things you want to say about Digital Health Festival Melbourne?
Look, I would say we came as a team from our practice. We had our medical student here, which I'm very proud of. She's done a case study on heavy metal freedom. Sorry, I'm not allowed to say that. And we had our practice manager, our business development manager, our 3 of our patients, most importantly, our GP. So it's been really good. I would encourage practices to consider coming as a team because a lot of the enthusiasm and the learning is actually non-clinical as well for your practice staff. And there are opportunities to network, especially if you're interested in research and advocacy.
My name's Nathan Moore, co-founder of Frameless Interactive. I've been a nurse for about 20 years, spent a lot of time in traditional simulation-based learning, did my Master's of Adult Education through that, and then about 5 years ago started looking at the use of innovative technology to train clinicians, things like virtual reality and artificial intelligence, started a PhD, so started looking at how we could use those innovative technologies to train clinicians, started a PhD looking at the use of virtual reality design and deployment considerations, became a Chief Nursing Information Officer, got involved with the Institute, and about 18 months ago stepped out of my role in the districts to co-found Frameless Interactive, looking at commercialising the technologies we've been researching.
Amazing. I love your story. It's like it's so broad, and that going from that clinical, the nursing, into that clinical informatics, that just everything that you've done, and now stepping into that founder place. Today, you're on a stage talking about AI, and AI is such a buzzword, and I sometimes feel like such a Gumby because I'm like, artificial intelligence, what does it mean? What are we terrified about? Can you explain it to me?
Look, I mean, at a really high level, what we're trying to do with the presentation today, so I'm filling in for Roy, who's an absolute gun in this space, but the topic of the title of the presentation is Teach Me AI Like I'm a 5-year-old.
Yeah, I'll be there.
And look, I got to say, and I'm going to make this joke in a thing, I feel like that is a bit of a tough sell, so maybe like a really bright 6-year-old is where I'm going to target it at.
Okay.
Yeah, so basically what we'll be talking about is how we simplify some of these concepts. So things like artificial intelligence, the ability to train a computer to think in a somewhat human-like way. But the fact is it is artificial, that it's not actually replicating human thought, but there's lots of processes, things like natural language processing, computer vision, neural path, all these neural networks, all these things that stitch together to then give us an example of how computers can think in a human-like way. But like all tools, we need to use the right tool in the right place, and it is not the magic bullet for all of our woes, and it's not something we should be cramming into every application we see. And you know, there's different parts will play a role in different settings, but it's really important for us to understand what AI can be and what some of the parts are, but also what it's not. And that's what I hope to tackle in a somewhat simplified way today.
All right. Well, I'm very much looking forward to hearing what that is. For our audience at home, what are some of what can it be?
So I think there's a lot of talk about productivity increasing and things. So there's some just really accessible tools out there that can help people. I mean, even just the really obvious ones, Poe, ChatGPT, that can allow you sort of talk about that blank paper idea of, you know, when you're just trying to start and you're like not sure where to start. Some simple prompting can really give you like a nice structure to start from. It's not going to be perfect and you will need to refine it. We're doing a lot of work in Frameless Interactive around AI-driven conversational agents for interpersonal communication skills. So the idea of using these AI-enabled agents to allow people to practice just talking to one another and replicating somewhat human-like responses. So a lot of education we have when we try to teach people to talk to other people at the moment is watching a video or click along with me exercises. And the Frameless Interactive, our motto is no more next button. So this idea that e-learning shouldn't be a click-along thing, that you can actually apply these principles and actually practice getting those words out of your mouth. And then when someone responds to you, you have to respond back in real time, and actually practicing that dialogue is a real
a strong use case that we see in AI, but all the machine learning stuff, computer vision around imaging, interpretation, clinical tools, the automation of scribing, we're seeing a lot of moves in, Liable and Heidi. There's a whole bunch of people playing in this space. So I think there is a huge potential for AI to augment our workflows. But for the near future, I think it is just that. It's an augmentation.
Yeah. So what is it not?
Look, I don't want to go on a record as saying it's not Skynet and it's not going to take over the world. But I would say it's not displacing a whole bunch of clinical roles, which is a discussion that I have heard. There's potential for it, again, to augment it and value add and support clinicians and the healthcare workforce to do their jobs better. I think there's been some it's been really interesting to watch it play out, because I know for a while in the earlier days there was discussion about how this will impact blue collar and automation. If anything, we're sort of seeing it to the other side, and the more white collar roles being disrupted, and some of the image creation stuff has been really fascinating as well. But I guess just at a really high level, it's not the one-stop shop for all of our woes, and that's the thing. So just weighing it appropriately, and like I say, right tool in the right place is what I'd think about.
We hope you enjoyed this episode of Talking Health Tech. Make sure you like and subscribe, and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.